Good morning, everybody, and welcome to AGM for 2021. My name's Elective. I'm the chairman of the trust, and it's a great pleasure to welcome you all here today. And as you can see, we're appropriately socially distanced with my executive colleagues, many of whom will be presenting the agenda today. We have a slide pack. We're going to share that with you now. And we'll move on to the next slide. So I think it's really worth reflecting on the year that we've had, and it has been absolutely like no other. Cast your minds back 12 months, and we were in recovery mode from the first wave of COVID, which had hit this trust very hard and the hospital very hard. But we could already see the trends rising as the schools went back, and later next month, when the universities went back, and our wards began filling up. We know what happened over Christmas and New Year, and for many of us, we won't forget that New Year with the pressures, particularly at Queen's Hospital, on our oxygen supplies. And the pressure on both sides. Overall, we had 24 wards dedicated to COVID during that period. All three of our boroughs were very hard hit, and that's really no surprise when you look at the levels of deprivation. One bright spot, perhaps, is that it highlighted the inequalities faced by our communities, and it's committed both the trust but the NHS nationally to doing something about those inequalities, which pre-existed COVID, so starkly made aware. So if we could move on to the next slide, please. I think it's well worth remembering how hard our staff were hit. We sadly lost colleagues. In addition to that, many of our staff come from overseas. Whilst they were busy serving our communities in East London, they were aware that their families back in their home countries were also suffering from COVID, many of whom lost relatives away from home, unable to provide that support. So we know what it was like for people who were bereaved. Many of our staff were bereaved. We're left with a legacy from COVID. We still have COVID patients in the trust. Numbers are thankfully relatively small and manageable, but it did impact heavily upon our other programs at work. And like the rest of the country, our non-urgent procedures were paused, and our elective waiting lists have grown. Meeting that waiting list challenge is even harder with the additional infection prevention and control issues that we put in place. And they continue to be in place to ensure that people coming to our hospitals can feel confident that we are doing all we can to protect them. The other impact of COVID on the trust was on our other performance and our financial challenges. These are long-standing, perhaps 2 decades of challenge in both performance and finance, and they've been exacerbated by COVID. But today we're going to be hearing both how we managed that over the past 12 months, but some really positive ways that we plan to address that in the future. But I think it's really important to use this opportunity, this AGM, to say a big thank you to all of the staff, all of the volunteers that worked so hard. That's NHS staff, but it's also the staff from our facilities management services, from Sodexo at Queen's and from NITI at King George. So thank you all for your tireless support, your tireless work, and the way that you really stepped up to the plate. Move on to the next slide, and I think it's time to talk a little bit about our recovery. So we are pulling out all the stops to meet the waiting list challenge. We have super clinics, we have bones days, bones weeks. We've introduced a whole range of new state-of-the-art diagnostic equipment, and we'll be hearing more about that as we move forward. We've reduced the number of people waiting a year for treatment. One of the best performances in East London, and partnership working is the key to working together, meeting the needs of our patients, and we'll be hearing much more about the way in which we plan to deliver really effective partnerships in the future. Our boroughs are at the heart of what we do, and we will be working with them as we move forward. We'll also be making sure that we work closely with our colleagues at Barts Health and the hospital to deliver the care on our elective recovery programme. Worth saying a little bit about vaccination hubs, which have been on both sites and have played a really big part, not only in protecting our staff, but also protecting the health and care staff that are employed across East London. Major work, so big thank you to all the staff that have been involved in the vaccination hub. Move on to the next slide. If there's one thing that COVID taught us, it was actually how central our staff are. It's our absolutely most important asset. So that's why we've spent time this year with thank you weeks, with a whole range of events to acknowledge the support that we've given. Thank you weeks aren't enough. We need to do those 52 weeks of the year. We know that your well-being is absolutely critically linked to patient experience and the outcomes. It's a key forward priority as we move forward, and we're going to hear more about the work we're doing to support staff and the work that we continue to plan to do. I wanted to say something about equality, diversity and inclusion. So when we talked about COVID, we talked about, and it's true that many of those impacted on our least advantaged communities, often Black communities, Asian communities, and those staff were well reflected in our team at BHIUT. They haven't always been well reflected in the leadership of the trust, and we've set on a new course over the last 12 months to really address the needs of all of our staff and make sure that we can be a fit place for everyone, where they all can reach the highest potential. And we'll hear more about our first ever board level director for equalities, diversity and inclusion during the AGM and the important work happening there. This is all just the beginning, and we're going to be hearing from our new chief executive towards the end of this session about the really exciting plans for the future and the way in which we plan to build upon what we've done in this last 12 months, but make sure that we have a sustainable, bright future for the organisation. We'll move on to the more formal parts of the business now, which includes the report from our Chief Finance Officer, Nick Swift. Nick, you're joining us remotely, so welcome, and I'll pass across to you now.
Great, thank you very much, Mike, and good morning, everyone. May I have the next slide, please, Linda? And again, please. So 3 slides from me, please. Firstly, summarising last financial year. The top left shows the number of COVID patients we had in our general and acute beds, and you can see it peaked end of December, beginning of January. In addition, we had a number of patients in critical care, so we did exceed 500, well over half our beds at that peak. The chart middle top shows the number of colleagues employed by the organisation. You can see the black bar shows an increase in permanent staff from around 6,000 up to close to 7,000. Further bank workers of around another 1,000, and then another 500 or so of agency staff. And in addition to that, as Mike mentioned, a number of colleagues from outsourced companies like Sodexo and Mighty. So a very significant increase in workforce, and that's led to, top right, some significant spend because of COVID, around 45 million in total. And you can see the top two items are workforce related, so 23 million pounds on pay, sickness and isolation. We did well for PPE. We've got significant spend on security, and then second to last line, some other non-pay spend, including medicines, for example. So substantial spend on COVID, and we're still living with some of that. The middle bottom tries to summarize the COVID costs versus the underlying costs for the trust. And we still think that the underlying deficit is at about £6 million per month, i.e. 72 or so for the full year. We were fully funded though for that and the costs of COVID. So bottom left, you can see that that allowed us to pay our suppliers and staff on time, which is clearly critical. And in particular, our suppliers, 94% of suppliers were paid within 30 days, and the balance really of 6% was largely due to just some disputed items. So we were able to look after our colleagues and our suppliers by timely cash flows. And then finally, bottom right, if you're interested in techie accounting, there was a prior period adjustment for our PFI. It's non-cash. You may be aware our PFI contract is 20,000 pages, so it's a complicated old beast. And we just did some tidy up on that, which resulted in some non-cash movements. Very happy to take anyone through that outside this meeting. Okay, next slide, please. So in addition to the ongoing costs, we were also far better supported now with our capital investment. And thanks to everyone that helped make that happen. So we did spend just over £50 million on capital investment. And what's particularly pleasing here is you can see it was spread across both KGH and Queen's Hospital. And we continue to invest in both sites in our estates and areas such as diagnostic and clinical equipment. And then you're also seeing that trust-wide, a significant start of catching up on digital. And thanks to everyone involved in the estates and digital delivery, we're really building up some momentum there. And then you can see some of the investments that we've made in the pictures. And we really are leapfrogging in some areas to get very advanced on things like robotics and imaging. So some really good things happening in our trust. So next slide, please. As we look forward, there's a number of areas that we're working on to get financially fit by 24-25, so in 3 years' time. And COVID has put us about 12 months behind on this agenda. But the three phases you can see in red, there's stabilize, then improve, and then finally optimize. And the stabilize part is, as the sub-bullet points say, to firstly remove those COVID costs. And there's some things we can do now. We're looking at security, for example, as hopefully some of the prevalence eases. But clearly we've got to be mindful of that COVID trend and what winter may bring us. But where we can, when it's appropriate, removing some of those COVID marginal costs. And then the organisation is really focusing on two big areas: the excess cost of bank and agency. So this is where it will cost us more than an equivalent substantive staff. And that's both unaffordable, but it's also unfair to have two people doing the same work, getting paid significantly different amounts. And thanks to, again, many people in the trust, we're making some good progress in reducing that excess cost. And then the second thing we're looking at is elective efficiency. You're probably aware we're doing, again, some really good things in our elective procedures. That makes sense for our patients to catch up. It also makes sense for our money that we can do more with the current assets. And as we get more and more efficient, that then also gives us license to expand. And we think we've got a really good emerging strategy to expand and improve our elective services. So the aim, if we can get that right, is to end this year, to 21-22, at something closer to 5 million a month rather than that 6 million. And then we keep going through the next couple of years improving. So we want to keep going on those temporary staff and elective opportunities, but also look at other areas such as the partnerships vertically, including demand and length of stay, and also collaboration with BARTs and other areas such as corporate services, and the significant further investment in digital. And then once we've done all that in a couple of years' time, we can then start optimizing through whole system patient pathway redesign using things like population health, informatics, etc., with a real focus on boroughs and inequalities. So that's the plan. Thank you very much for your time.
Nick, thank you for that. We're going to now move on to Ben Moran, who joined us this year as Deputy Chief Executive, and he's taken a particular interest in making sure that we work around the staff wellbeing agenda. So Ben, over to you.
Thanks, Mike. It's my pleasure to talk a bit about the superb teams we have at BHRUT and the importance of caring for them across all the work they do. My next slide talks around the 5 core elements of the way that we hope we do that well. The first of those is about caring for all of the colleagues across the whole of the organisation and our partners, our local communities who work with us. The second is about how we make sure that tackling inequalities, thinking about the safety of everyone who works with us, and thinking about the enhancements we want to make to the diversity and the leadership of this organisation are at the forefront of our work. The third is thinking about how we bring our values to play in everything we do today in our behaviours across the organisation. And as we do that, we think about how we develop teams in the organisation and our future leadership style too. Thanks. Now, this year's been a really difficult one, and with the support of a colleague, Gemma, I'm showing a message here which I think speaks well to the type of challenges colleagues have spoken of when caring and thinking about the implications of the pandemic, both in terms of the immediate implications of caring for people in local communities with COVID, thinking about the implications for our families and people around us and the communities that we serve in North East London. And Gemma's given me her permission to read out this recent tweet, which is one of many examples of how staff have spoken about the implications of the pandemic for them. It's been a strange old day. I cried a lot in a therapy session, which I very much needed to. It's really made me recognise how much we've all bottled up about the last 18 months and how it's affected us individually in my line of work in a personal and unique way. Our support as leaders and managers to colleagues across the BHRUT needs to be about recognising the individual impacts of the pandemic and how at our best we can further inspire, improve support for colleagues currently here and the future workforce of the organisation. And my next slide talks about one example of how we're doing that in relation to the first principle of our work on organisational development in relation to caring for those who care for others, all of the colleagues who work for us and with us across our teams in BHRUT. And what that really has meant is about staying close to colleagues and learning about their individual experiences. And we do that by surveying them regularly and talking to them most crucially about how they're finding their work. It's great to see some trade union partners with us this morning, and the way that trade unions and staff networks play a role in guiding what we need to do is absolutely crucial, so we make sure our ideas and what we take forward is guided by and designed by colleagues and staff all through the organisation. And we have a dedicated forum meeting every week where colleagues are invited to come along and share their views about how we're doing and what we can do next. And their earliest ideas are focused on physical, emotional, mental well-being and how we can think about that more perceptively through better investment. And that's why all of our staff rest spaces across the organisation are being refurbished, while we're now offering food and support for colleagues 24/7. We have new discounts for staff across the organisation to get food and the basic things they need at work. We're thinking about a range of further ways in which we need to think about the individual needs of communities within the organisation. And Remy will speak a bit about that in a minute, because EDI is at the forefront of that work. And we're making sure that offer is extended to our partners who work for contractors with us, be they colleagues who are cleaning, offering security, our catering staff. So there's no hierarchy in the way we offer those commitments. Now, the implications of the pandemic will stay with us for years ahead, and that's why we need to think about the mental and emotional well-being needs of our staff individually and collectively, and why we're tripling the investment we make in those areas in the next few years. And that's crucially coming through in terms of the way we think about debriefing and making sure that we recognise that beyond the pandemic, as we redouble our efforts to treat patients faster and quicker, the needs of having great colleagues here well supported will be even more crucial to the work we do across the HRUT. My pleasure to pass over to Remy, Group Director for EDI Next.
Thank you, Dan.
Thank you. Not know what's going to come. What is that?
I'll do that for you.
Thank you, Ben. Good morning, everyone. Thank you, Ben, for taking care of me and cleaning my seat. I'm happy to be here this morning. And as you can see, my first slide is, sorry, if we go back to the original, is a picture of where we would like to be. And from a perspective of equality, diversity, and inclusion, I want to remind us that this should be the DNA that runs through the functions and activities that we have within the organization. First slide, please. So I've been in post for 115 days, and I'd like to share the journey of the EDI team and everyone else involved in this work. As I said earlier, the EDI should be our DNA, and our strand shows a lot of the activities that we've been involved with. One of the things that we want to do is make sure that we are culturally sensitive and that we are actually listening to what our staff have to say. I'd like to remind us that our staff are our most valuable asset, and if we ensure that we have an environment and culture that nurtures people, then we will get the best out of them. And as such, our networks and staff side are very much key to enabling us to do so. We've got 4 staff networks: the Women's Network, LGBT+, Ability and not Disability, and the BAME Network, which stands for the Black, Asian and Minor Ethnic Groups. And the chairs of these networks are currently members of the People and Culture Committee. So they're there to help to hold us all to account. We are working in partnership with them to ensure that any initiatives that we agree on, we co-design with them. Key areas for our staff to feel valued and respected is around how they progress in their careers, and therefore training and awareness is really, really important. And as such, we're looking at a key area of recruitment, working with partners within the recruitment in HR to ensure that we change our policies and make them fit for purpose and fair. We're also looking at talent spotting, and therefore we have a positive action program called Inspire. We're in our 4th season now, where we have had BMA background staff attend. I think the 4th one has been open to all members of staff. We're also in our 2nd season of reverse mentoring, and I know that some of my executive colleagues have actually taken part in this, and we've had really positive feedback about how that has impacted on understanding the lived experiences of our staff. We are glad to have been selected to be one of the organizations to attend the White Allies, and we currently have 6 members of staff attending a new program on the back of the impact of COVID that was developed by NHS-I&E. And they have currently attended 2 of those sessions, and I'm looking forward to hearing the feedback not just myself, but also the rest of our colleagues within the organisation and how that will impact on our culture. We are also part of the Calibre Positive Action Programme, which is a talent development programme for those who identify with disabilities. Recruitment has been a really big issue within the organisation, and as such, as I said before, we have developed a manager's guide for recruitment whilst we are working on redesigning the way we recruit and retain our staff in the organisation. So expect to hear from me later on in the next year about the improvements that we have made. We are bringing our internal stakeholders together by creating a steering group, and our first meeting is actually tomorrow to ensure that the hearing that we're doing on the floor and the decisions that we make and agreements that we have are scrutinized appropriately by the stakeholders. At this point, I'd like to say that I've done a lot of walking, and although you cannot see my feet on the table, I am wearing my trainers. I've had the privilege of walking the floor with a couple of our non-executive directors at 8 o'clock in the morning. I do apologize for that, but it's the best time for us to have been able to meet with staff and staff teams. And we've managed to do about 18 of those walks, both in King George's and also in Queen's. We celebrate our staff as much as possible, and we have an inclusive calendar and make sure that we are sending out messages and actually hearing what staff would like to do to celebrate those particular days, so that people also feel that they are being respected and valued in terms of who they are and their backgrounds. We have trained 47 not 47, we've trained a few more diversity partners to ensure that for all senior interviews do have diversity partners on the panels. And we also have 12 EDI champions on the shop floor who are supporting the voices of our staff so that there is balance in terms of what we're hearing from staff. Our business as usual sits around our RES data, which is our workforce race equality standards, and our WEDES data, which is our workforce disability equality standards, and we continue to do that. The gender pay gap, I'm glad to report, has been taken over by our co-chairs of the Women's Network, with an intention to do a deep dive to have an understanding as to why that pay gap exists and what we have to do to redress it. So we are working really hard on trying to listen and identify the issues that are important to our people, and then work to redress whatever needs to be redressed. That said, we're also celebrating, just as Ben said, and recognizing our people, recognizing good practice, and sharing that at a different team meetings. I would like to use this opportunity to give a heads up to Victoria Miles Gales, particularly who has headed the LGBT forum for the last 2 years and has currently stepped down, and we now have 2 new co-chairs. She's done a lot of work with her team members, and I'm glad to report that we're now members of Stonewall, which is, I think, an accolade for the organisation that we are paying attention to the needs and the differences amongst our staff members. We are also looking at disability confidence. There are 3 levels. We're currently at level 1, and our intention is to work towards getting to level 3. And what I didn't mention at the beginning is that the EDI journey is owned by all of us. It's definitely not a sprint, it's more of a marathon. So we expect that we will be making little bite-sized changes, but these changes will take us to where we want to get to. I'd finally like to say that the Guardian Service, which is an independent service, is another opportunity for our staff's voices to be heard. And they're extremely busy. They've had 48 contacts so far this year. which is more than the number of contacts they had last year. So for us, it means that we are narrowing the gap on our blind spot and beginning to understand more of the issues that are pertinent to our staff members. Thank you. Next slide, please. So this is a really busy slide, but what it tells us is that there's a lot of work to be done, that we want EDI to be part of our DNA, part of our culture. And with that in mind, we've picked out some key priorities. The first one there is our recruitment and inclusion, or recruitment and retention is what we're going to call it now. We're also going to look at patient initiatives, but for the time being, in the next year, what we want to do is really focus upon our staff, celebrate them through the inclusive calendar, give the staff networks more of a voice, and make sure that we engage with our stakeholders, both internally, excuse me, and externally. And we also want to ensure that our policies are just and fair, and therefore we're reviewing our equality impact assessments, particularly when we're changing services or improving services or introducing new services. Our partnerships are very important to us. What we don't want to do is reinvent the wheel. And as such, we are making rich links with outside organizations to learn from them and bring that learning into the organization, and also to seek support and support them as well. So we've made links with NELFT, we've made links with ELFT, and obviously with Bart's help as well. But we are also making further links with organizations who are doing very well around their staff survey, with a view to taking that learning and bringing it back into the organization. In terms of improving staff experience, it goes beyond recognizing the value of what our staff are doing to actually listening and enabling our staff to reach their potentials. And therefore, we want to build up a leadership diversity program over the next 5 years. In terms of cultural sensitivity and intelligence, there is no alternative to raising the bar on our understanding, and therefore we will continue to walk the floor, we will continue to speak up at team meetings, and we'll continue to communicate any of the issues that we are currently dealing with through the various regions that we have. Next slide, please. And finally, getting there. We have, as a team, agreed a vision which aligns with the Trust vision. And this is about having a leading organization that attracts and retains talent, where people are proud to work and patients receive highly reliable care. And our mission statement is that we want to champion this organizational culture to embrace the diversity of our workforce and be intentional about including people in everything that we do, so that they will thrive, our services will thrive, and our patients will thrive too. We're fully aware that we are still in a pandemic and that our staff are going through a period of recovery, and we understand that that will have an impact on how the EDI agenda works, and we will work hand in hand with our staff to ensure that we carry on with this work. We also will promote the EDI team, which is quite tiny. There's about 3 members, 4 including myself, and we will use our links with our partners, our executives, our non-executives, our staff networks, to ensure that we are fully visible and listening. And finally, I'll just say that the impact of our clinical strategy, our BARTS collaboration, the integrated care system, and our patient initiatives around health inequalities be part and parcel of all the discussions that we have as an EDI team. Thank you.
Remy, thank you very, very much. And I think it's fantastic that we are one of the very, very first trusts in the country to appoint an executive director level post to carry forward the EGI agenda. So wishing you every success in the future and look forward to its progress.
Thank you very much.
Great pleasure to welcome Hannah Coffey, who is our Director of Strategy and Partnerships. And Hannah also joined us at the beginning of this year and has made a huge difference to the work that you do across North East London organisations. Hannah, across to you.
Thank you very much, Mike. And good morning, everybody. My name is Hannah Coffey. I'm the Director of Strategy and Partnerships here at the HRUT. And I thought before we go on to the first slide, I thought it'd be helpful just to set a tiny bit of context in terms of what we're doing and the environment within which we are increasingly operating. I think it builds beautifully on what both Ben and Remy have said, because this is about listening and responding, as well as the policy environment that we're in, and increasingly that is about how we set our strategy and our partnerships too. So many of you will be aware that there's a Health and Social Act going through Parliament as we speak. It gives us a duty to collaborate with others, and I think that we need to recognise that we are operating in an increasingly complex world. It's called the Matrix. It feels like sometimes we're in the Matrix, but ultimately this is about relationships and activities that happen at all sorts of different levels with lots of different partners, and it's complex. So part of my role is to try and help us bring coherence to the policy and think about not just what we do, but increasingly and importantly, how we do that. We can't solve any of our problems on our own. Everything we do will have to be in partnership with others. And it's really important, and I can't emphasize enough the importance of developing long-term trusted relationships in terms of our ability to deliver, importantly for our population and an increasingly impoverished and deprived population. And our responsibilities are absolutely about delivering high quality care here, but also about how we play into and respond to the longer term health and social needs of our population. So I'm going to talk to you that in that context. I don't have pretty slides today. I feel quite bereft actually. And I have a small but perfectly formed team of 2 of us undertaking this work at the moment. So if we go into a little bit about what we do. So as I said, it's a combination of what we do and how we do it. And the importance of strategy is about being clear about where we're going and ensuring that the way we are joining up our work, our priorities and our structures are coordinated effectively to deliver that vision. Then it's about how do we get that vision? So importantly, and the work of myself and colleagues is about working with health, social care, voluntary and other statutory partners, as well as our patients and residents, to ensure that they have a very clear voice in determining what we do, how we do it, and how we prioritise our work. Again, about the longer and wider population needs of our population. So, so what my role is to do is to coordinate a set of activities that allows us to do that, whether that be at the North East London Integrated Care System, which covers the whole of North East London, whether that's about Barking, Havering and Redbridge, so what was in our integrated care partnership, whether that be in an individual borough, and we have 3 boroughs that we work with, or whether that be in collaboration with other providers, such as the work we're doing at the moment in collaboration with Bark Health. So essentially, what are we doing, how are we doing it, and how do we organise the activities and deliver the activities we need to for our population, for our staff, at all of those different levels. Next slide, please. So what have we been doing? Well, I think in many ways we've been setting strong foundations. As I go to refer back to what I said at the beginning, you can't do any of this unless you have trust and you've built good relationships. And there was a huge amount of that during COVID. So much of what we've been doing is building on that, looking towards the future direction, particularly at our borough level and with our provider colleagues, and thinking about what we needed to do to build those relationships and to make sure that we are looking outwards as much as we are inwards. So one of the things we've done is establish non-exec and exec and senior clinical and operational buddies that sit not just on our health and wellbeing boards, because that's where we have do a lot of our partnership discussion, but in our borough partnerships, in our clinical transformation boards, and ensure really that we are connected with and delivering changes together. So we have buddies that sit in our borough partnership, in our health and wellbeing boards, and on those transformation boards. We've also been spending a lot of time working through and resetting our clinical strategy, something that was in place in advance of COVID, but hadn't quite been completed. And this is about ensuring that we have a strategy that responds to the policy context that I described to you, but also that we're bringing along and have brought along all of our colleagues with us in terms of what we do. It's important that we hear what people want us to do and that we respond to that within our clinical strategy. And our clinical strategy really is about what we do within the walls of the hospitals that we run, how we work with our partners in collaborating, for example, with Barts and the Homerton, and how we have a deep integration with our boroughs and at place, and make sure that we're able to be a really important partner in terms of delivering for our local community. Also, importantly, obviously one of the challenges through COVID was around continuing to deliver as much as we could around some of the elective and cancer pathways. So one of the members of the team had a very important role in ensuring that we had an independent sector activity capacity available for us, so we could continue to treat patients through the height of what was a really challenging COVID crisis here. So much as we know that we're in a situation of trying to respond to a backlog at the moment, we were able to treat over 400 patients a week, so that they could continue to get access to clinical services as and when they needed it. And that has put us in good stead, particularly on the diagnostic and elective backlogs, because we're doing incredibly well through the team's hard work. And then finally, we've undertaken, I know many staff have been involved in that, as have partners, an appreciative inquiry. So this is about how do we work more closely with Barts Health in collaboration, what are the things we could be doing together, and we undertook an appreciative inquiry, which is again about listening, responding, and ensuring that the priorities that we set are responding to the needs and concerns of not just within the organisation, but outside of the organisation as well. So many of these things are about setting a way that we want to work, but also setting the foundations for key work that we'll be doing over the next 3 to 5 to 10 years. Next slide, please. So our priorities for next year. So relationships don't happen overnight. So importantly, continuing to strengthen our relationships with partners, both in the boroughs and in the wider integrated care system, which is developing at the moment, and we are inputting into the development of that, because that will be a key partner for us over the next few years. And I think importantly, being clear, what are we going to deliver as a trust, and also with our partners, and also playing a really active part in the design of future services and systems, and also importantly in scrutiny. So referring back to health and wellbeing boards and overview and scrutiny committees, ensuring that we are being held to account and are open and transparent about the things that we are doing. We'll be finalising our clinical services strategy. We hope to be doing that towards the end of the calendar year. Obviously, we've got winter to contend with, so we're being quite flexible about what's coming out of it and how quickly we will finalise that strategy. But that will be by the end of the financial year, certainly. Importantly, doing that with our partners, with patient residents, and designing that together. Importantly, recognising we have a role as a large employer, and also 79% of our staff are also local residents. So it's as important to us because of our staff as it is because of our residents as well. And we also spend money, a lot of money, and we, how we can utilise that spending power for our local community too. We'll also be further developing the work with Barts Health in terms of our priority areas to demonstrate real benefits to our patients, our staff, and to our local residents. And we've already started, there's already activities happening at the moment which demonstrate patients that have been seen more quickly, work that we're doing around Barking Hospital, around how we can enhance services there, things that we probably wouldn't have done otherwise if we hadn't have had that conversation when we had. And finally, no point talking about everything you're going to do if you don't have a mechanism for delivery. So importantly, how we're organising ourselves and focusing on ensuring that we have robust business planning and strategy implementation processes that give us confidence, but also our partners confidence that we will do what we say we're going to do. And I think that's a really important part of not just what we're going to do, but how we're going to do it, and building confidence that we will do what we say we do. So I think that's probably it from me. I'm feeling slightly nervous, but I've got to do infection control, and it's our chief nurse I'm doing it for. So don't judge me from the quality of my cleaning. So thank you very much, and I'm going to hand you over to Catherine, our chief nurse.
And thank you very, very much. Welcome to Catherine, our chief nurse, and the leader of the largest staff group within the trust. So, Catherine, welcome.
Thank you very much indeed. I think you did that beautifully, Hannah, so you could have a start.
Thank you.
So I'm going to talk a bit about corporate nursing, and I'd like to introduce the corporate nursing boy band photograph. I like this photograph because I think we look like a boy band. We don't sing together, but we work together, and we work very hard together to make sure that we can have the best quality of care for our patients that we can achieve. There are 6 of us plus myself, and I'm delighted that they've been part of my team for probably the last 2 years or so. Next slide, please. So we have a number of areas of responsibility, quality and safety, obviously, and this really falls into a number of categories. We work very closely with CQC, who obviously haven't been in particularly to visit us during the COVID period, but have done a review on maternity services and radiotherapy services over the last few weeks. But despite them not being on site, we've kept in contact with them every fortnight, and we've really kept them up to date with what we are doing. We're responsible for the quality of care that's received by patients on the wards, and that's been really important during COVID. Our staff have had to learn new skills, new abilities, and to nurse people in very different ways. So that's been a real challenge for us. And also we have a ward assurance programme where we look at how our are measured against a number of metrics and how we have a big safeguarding responsibility, so that covers adults, children, learning difficulty and dementia. And particularly during COVID, learning difficulties coming through our doors have become one of those groups where we've really focused to make sure they're having the right standard of care as they come through. Patient experience, of course, we always use patient feedback. Friends and family tests have been really important to us. We haven't had as much of that during COVID. We haven't been able to get as much patient feedback as we have done in the past because we rely quite heavily on our volunteers and our patient partners to lead that work. And they obviously weren't able to join us on site during some of the waves of COVID. And I'd particularly like at this point to mention our patient partners and Sarah Tull, who's been a really strong advocate for us and a really strong member of our patient partner team for the last 11 years, and she's leaving us today because we're having a party in here after the AGM, obviously social distance, but to celebrate that 11 years and wish her well as she moves to Kent. We also look after non-medical education and training. We've done quite a lot of work over the COVID period, particularly around interprofessional preceptorship, mandatory training, really building on our apprenticeships and building the academy, which we launched last Thursday. And then finally, nursing, midwifery and HP workforce development. We need to look at what does the workforce look for the future and how does it continue to meet the needs. Thank you very much. So if we look at achievements, what have we done? In terms of quality and safety, we've maintained our standards, and that's been no mean feat. In the first wave of COVID, we had up to 25% of our nursing staff off. So to be able to continue that was a challenge, but we have managed to do it. As I say, we continue to work with CCG and the CQC. And lots and lots of our nurses, they've had to learn new skills. This also applies to the AHPs. So we have teams of nurses who were looking after care of the elderly patients who we were having 50% of our beds full of COVID patients. suddenly had to look after a patient in much more of an HDU environment, so a high dependency environment. They did that within 24, 48 hours, and it's a real testament to the leadership of the nurses at a local level that they were able to do that. Last New Year's Eve, we thought we might have a respiratory receiving unit at King George Hospital. By New Year's Day, we had a respiratory receiving unit. We were in overnight, the teams were in overnight developing that, but alongside that, we needed to have the right skills. So our clinical nurse specialists redeployed themselves to support teams in those local areas. And I'm pleased to say that we did provide high quality care to patients, even if it was in an environment where people were unused to looking after those particular groups. In terms of workforce, we set up a workforce hub so we could redeploy our staff to the right places and of the greatest need. We've set up an entirely new electronic system so we can see where every single nurse, midwife and AHP is in the organisation and move them around depending on the dependency of patients. We've developed a Chief Nurse Fellow programme, so we have lots of our staff coming to spend some time with myself and the corporate nursing team, really learning about what does it mean to be part of the corporate nursing team, what does it mean to work at this sort of level, and it's not just an ivory tower where we sit around and drink tea all day long. They're actually quite surprised by the work that we've done, but as a result of that, we've had about 170 people through that programme. The vast majority of those individuals have either changed post or been promoted, so it really has stimulated that movement through the workforce and actually supports the work that Romy was talking about before. We've also worked quite hard on how do we get our children and young people into the workforce of the hospital. We've run some apprenticeship programmes for them, and we've now built on from the pilot that we ran last year into an integrated partnership with both West Ham and DWP, Department of Work and Pensions, and we're bringing more young people who perhaps are quite marginalised in society to be part of our workforce going forward. And in terms of safeguarding, I identified the safeguarding areas that we're responsible for, but also just to say that we've updated all of those strategies over the last year. And then, as I say, I've mentioned a couple of times on how difficult it's been to provide care during COVID, and I think we should just continue to celebrate that. It's not just nurses, AHPs, midwives, it's also the medical staff, and actually some of the administrative staff have really changed what they've had to do. So in terms of our ambition, we want to continue growing our patient experience and community engagement. As I say, it was quite difficult for us to do during COVID, but we did when we were developing our learning difficulty strategy. We were able to engage with those community individuals and community groups, and we will continue to do that and continue to improve. That's one of our key objectives. Our Health and Social Care Academy, as I say, was launched last week, and that's a real focus on how do we grow our own, how do we grow our workforce of the future. We've done quite a lot of work around that in this organisation already. Our healthcare assistants, our health training programmes are now registered nurses. We've moved that into some of the allied health professionals, and it's moving into midwifery. But how do we extend it beyond that? So how do we look at, we were talking this morning about how do you grow from a ward clerk into a general manager, what does that look like? And how do we make sure that our communities are the people who are working within our home health and social care sector? And then our ward assurance framework. This really provides the evidence that the quality of care that's being provided is good, and it's much more detailed than the work that we've been able to do previously. It's something that we've been aspiring to do for the last couple of years, or probably 3 years. We were hoping to launch it just before COVID. Obviously, we had to delay it, but we've now got back on track, and by the end of the year, all wards will be assessed. And then finally, I mentioned before that we've had 2 CQC inspections. We will expect a lot more inspections of the CQC are starting to ramp up and return to their normal level of activity. We would expect to be re-inspected by them, and we will continue working with them. Thank you very much indeed. I'll hand over to Mark.
Thank you very, very much for that. And I think that we can be rightly proud of the commitment of the corporate nursing team to the development of our nursing staff, but also our AHPs and others, the opportunities that we're providing to local people, many of them from the disadvantaged communities. So thank you, Catherine. Great opportunity to welcome Magda, our Chief Medical Officer, One of the areas that I've been hugely impressed with in joining the trust is the commitment of our clinical leaders across the organisation to the transformation agenda. And those clinical leaders and their passion are inspired by our Chief Medical Officer. Magda, across to you, please.
Thank you very much, Mike. Thank you. Do you want to move on to the next slide? So good morning, everybody. So this is just really a bit of an explanation about the areas of responsibility of the Chief Medical Officer and BHRUT. And the obvious area of responsibility is for the medical professionals in the organisation, the doctors. And we have about 1,500 or so doctors. 350 of those are consultants. 100 of those are going through Health Education England formal training programmes. But we also have 850 locally employed doctors, which make up a significant part of our medical workforce. But as a CMO, I am responsible for making sure that doctors are up to date and they are revalidated to be able to continue with their practice. I'm also responsible for ensuring that our doctors get the right level of medical education, and that's not just those informal training programs, but those who are locally employed by us as well. And we've had some exciting initiatives over the last couple of years, and in particular the last year, around developing what we're calling internal academies of education for those groups of staff, particularly in surgical specialties, recently celebrated in the HSJ Awards, Health Service General Awards, but also in other areas such as the A&E department. I'm also responsible as the executive lead for our healthcare scientists, and I do want to give a big shout out to them, and I'll talk a little bit about what's been happening with our healthcare scientists in the last year. I am the lead for clinical research in the organisation. In 2020 to 21, I was also the Director of Infection Prevention and Control, and I'll share a little bit about that journey during a COVID pandemic. We lead on clinical quality and outcomes, and in particular are responsible for ensuring that we have appropriate reviews of those patients who sadly die within our organisation, to ensure that care is appropriate and of a good standard, but also other clinical quality standards. And then really importantly, around working with our partners in primary care, with public health and our borough partners, and with our local acute mental health and community providers. And Hannah touched on this, and we've talked a little bit about our clinical strategy, but obviously a clinical strategy is clinical, and I work really closely with Hannah and with Rennie and the team to take our clinical strategy forwards. Thank you, Carly. So what have we managed to do over the last year? So just focusing around medical education of the doctors and our medical professionals, we have expanded our undergraduate places offered at BHRUT quite significantly in a response to a national drive to increase the training of doctors for a future workforce. We moved all of our medical education online rapidly in April of last year, as we were going through the first peak of the pandemic, so that our doctors and others could actually continue with their education when we were no longer allowed to meet in rooms together in large numbers. We also recruited over the last year a new Director of Medical Education who has a significant amount of time to be able to dedicate himself to improvements in medical education. But also, we also took a decision to recruit to additional support for guardians of safe working hours. These are statutory roles to ensure that doctors, the statutory role is around doctors in training to make sure that they have appropriate rotas, that they get appropriate access to educational opportunities, but we took a decision that we would expand that role to ensure that our locally employed doctors are also looked after in the same way. That is a work in progress, but we have made some good movement on that. We also managed to ensure that our doctor appraisal processes continued throughout the pandemic, and we established a professional support unit to ensure that we are monitoring the standards to which our medical professionals work. Our healthcare scientists. Healthcare scientists are an enormous group of our staff who work in all sorts of different areas. So a healthcare scientist can be somebody who works in our laboratories as a biomedical scientist.
They can be a physiologist, so working in the cardiac labs. They can be a medical photographer, and our medical photography team has done an enormous amount of work ensuring that we have got the right amount of promotional work, informational materials, working with our comms team over the last year. And you will have seen multiple videos that we've been producing around all sorts of areas, how to look after yourself with personal protective equipment, videos around vaccination, where we are with COVID and what our response has been. But it's also our medical engineers, it's our nuclear physics teams, and I always miss a team out, so I'm going to apologise in advance, but it's a large group of staff. I'm really pleased to say that we recruited to our healthcare scientist leadership team, and we have 3 healthcare science leaders now in the organisation, and that is really important for us going forwards. And we can't underplay the role that our healthcare scientists have had in the pandemic response. Our laboratories had to completely change what they were doing very rapidly. We've introduced new testing, new processes to ensure that we can make sure staff and patients are appropriately tested and looked after. Our medical engineers were receiving hundreds and hundreds of pieces of new equipment, our clinical engineers, sorry, of new equipment as we were importing ventilators and additional breathing machines, and managing our oxygen services, and really having to adapt themselves very rapidly, as have many other members of staff. And I don't think we can underestimate, we don't talk enough about the role of our, what we might call our office-based staff during the course of this pandemic. At the height of our winter period, our finance team were monitoring our oxygen levels on the wards. So people have had to adapt and change massively through the last year in the support to the organisation, which I think as an organisation we should be very proud. One of the things that has underpinned the COVID response has been the clinical trials. So whilst we had to nationally stop doing clinical trials that were not absolutely critical to patient care, we participated in the National Public Health Clinical Trials, recruited over 2,500 patients to those trials. And I just want to call out in particular the recovery trial, which has transformed the way we care for patients who come to us with COVID. So in April of last year, we knew very little about what treatments could work in COVID. And really it was the recovery trial that led us to our first treatment. So there were lots of thoughts about what might or might not work, but actually participating in the recovery trial, entering patients, we then came to a very rapid national understanding that a very simple basic drug that we use every day in our hospitals, which is called dexamethasone, made a difference to patients. And that recovery trial has continued and continues today, and has introduced many more treatments for patients who are coming to us with COVID. So I'm really, really proud of our research team, who again had to adapt and change. It's not a big team, it's very, very nurse-led, but they actually have changed the way they work and were moved onto the front line to ensure that our COVID patients were getting the right access to those trials. And again, infection control. So I'm talking a lot about our COVID-19 response as the DIPSI. That has been a huge focus of attention over the last year. We had a very small infection control team at the beginning of this period. They have been able to take on board, to adapt, to move to 7-day working, to absorb all of the information that was being given to us, the guidance, to work with our procurement teams and our clinical teams to ensure that our staff had access to personal protective equipment, that our patients were protected in the best way possible from hospital-acquired COVID, so transmission of COVID from COVID patients who were admitted to hospital, working with our laboratories, working with our testing teams to make sure that our COVID-19 response was as good as we could make it. And really, really need to recognise that team. We have grown that team, which has been a huge learning for us, but also a huge learning for our organisation in terms of really embedding very good quality infection control practices across the organisation. Anybody coming to our hospitals at the moment will know that to come into our hospitals is very, very different to 2 years ago, and continues to be so, but we are constantly revising our infection control practice, and I was very pleased to be able to hand over the role of Dipsy to our chief nurse in April of this year. And she's taken that on and is moving that forward in ensuring our infection control response continues to be appropriate. It did sadly mean that we had to put a lot of restrictions in place, as did every organisation, health and community organisation across the country, in terms of visitors. And our clinical teams, nursing, medical and other health professionals had to work very hard to ensure that communication with families was appropriate and timely. And that has been a real challenge for us as an organisation. And we have adapted new ways of communication very, very fast, supported by our charities in acquiring equipment such as iPads for us to be able to communicate face-to-face with families. In terms of quality outcomes, over the last year, we have very much focused on mortality reviews for those patients who have been admitted to our hospitals and sadly those who have died from COVID-19, to ensure that the care that we delivered was appropriate and timely for those patients. And I'm pleased to be able to say that we have reported regularly to the board on our mortality reviews throughout COVID-19 and the care of the patients that we serve. And we are continuing to do work around this. And we've also started to recruit to our medical examiner programme. This is a national programme of recruitment of medical examiners who provide scrutiny of deaths within the organisation. And from next year, we'll be moving to scrutiny of deaths in the community as well, to ensure that appropriate care has been given and to be able to communicate with families where there are concerns, and also to communicate with Her Majesty's Coroner where those concerns may relate to the coroner's jurisdiction. And then over the last year, in particular working with partners, it's been absolutely critical for how we've responded. I'm just going to talk about two secondary care focused areas of working with partners, but actually we've done a huge amount more in terms of communication with and working together with our borough partners with things like around, for example, the delivery of the vaccine programme. But in terms of urgent care and critical care, our intensive care units across the land were put under extreme pressure. We knew this was going to happen, we planned for it, and we delivered it, but we delivered it in collaboration with other critical care services. And in North East London, we developed something called a critical care hub, where our intensivists were having conversations on a daily basis around care of patients that needed intensive care. And out of that developed a patient transport service, which pre-COVID we didn't think you could do safely, to ensure that patients who needed an intensive care bed could be safely admitted to an intensive care bed, even if it meant that those patients had to be taken to another intensive care unit. That critical care hub continues and is being built on. Similarly, clinical leadership around our urgent care collaboration has developed hugely over the last year. And we continue with an urgent care hub where our operational managers with our clinical leaders meet on a regular basis, depending on the status of our organisations, to ensure that patients who need to be brought to the emergency departments and admitted into hospital get as timely an access as we can manage at the current time. And if that means that actually we work with the ambulance service to bring patients perhaps to an A&E department that's under less pressure, that we've been able to do that in conversation. Thank you very much. So what are our ambitions for the next year? Well, around medical education, we've got a lot of work to do around the experience of our trainees as they come through our organisation, and that is reflected in our GMC survey, which was recently published. I will be absolutely honest, we have some significant challenges in improving the quality of training in some of the areas that we have trainees, but we've also seen improvements in some of our other areas that we absolutely need to learn from across our organisation. We want to enhance the education offer for our locally employed doctors, and we are going to build on our local academies. And working with partners, and in particular QMUL, we are working to support apprenticeship degrees for doctors. So traditionally, it's not been thought possible, but actually this is a big initiative by Health Education England to support these apprenticeship degrees, which we believe will enable a wider part of our communities to start thinking that medicine is a possibility for a future career. We want to develop our career support programs for our healthcare scientists in terms of development, and this is a major opportunity. This is a group of people who are highly skilled at what they do. They are professionally qualified, professionally regulated, and can make a huge difference to the way we deliver care, not only in our organisations but across our communities. We want to build on our capacity for research delivery. We have a very enthusiastic team, but some of this will work in collaboration with Barts Health, who have a broader experience of delivering research, and we have already started those conversations as part of our Barts Health collaboration. We will build on our framework around quality outcomes for our patients and I should say patient partners, not patient patterns, I do apologise, and actually involve our patient partners critically in this work. Catherine mentioned Sarah Turl, who is sadly leaving us as a patient partner to go on to new and exciting opportunities for her, but she has been a huge support and challenge to our conversations around clinical quality and outcomes for our patients, really adding that patient voice into how we think what outcomes actually matter, which can be very different from a medicalised view of the world. We're going to expand our medical examiner's office to ensure that we're ready to meet the requirement to offer that scrutiny of community deaths, working with our community partners in primary care. And again, continue to work through our clinical strategy with our partners and really ensure that we can land a strategy that is recognised by our local residents and our borough partners as much as it is by our clinical teams. Thank you very much.
Magda, thank you for that, and I think absolutely inspiring to hear the work of our medical team. Today actually is my last day at the Trust, and it's been an absolute privilege to commence and lead the journey of renewal at the HWT. And it has been a great opportunity to have a last day with a year, which is all about reflecting on the year just gone, the achievements. And for me personally, it's a great opportunity to say thank you to my executive colleagues, but also thank you to the wider organisations and the many people. It has been, as I say, a real privilege to be at the organisation. But I would like to use this as an opportunity to reflect upon the future. So I was brought into BHRUT last autumn, and there were two principal tasks I was given. The first was to commence the stabilisation and refreshing the leadership of the Trust. I'll say a little bit about that in a moment. And secondly, to establish a new strategic direction for the Trust, having abandoned the potential merger with North East London Foundation Trust. The Trust found itself in a position where there wasn't an overall strategic direction for the organisation. So they were the tasks that I was brought in to do, and I'm going to say a little bit about what I think that means for the future. So Carly, if we could move on to the next slide. I think probably the biggest challenge the Trust has faced over many, many years has been the revolving door at the top of the shop. I think there have probably been in 20 years something like 15 chief executives, which is a staggering amount. And it's no wonder that the lack of stability in senior leadership can be reflected in some of the performance and financial challenges that the Trust has faced over the years. And in many ways, it's a testament to the commitment of our staff that in spite of what has been happening at the top of the shop, they have continued to deliver high quality care to the people of North East London. So I'm absolutely delighted that during the course of my time with the Trust recently, We have completed the recruitment of a substantive chief executive, and we'll be hearing from Matthew shortly. This is, I think, the first permanent chief executive the trust has had in at least 5 years, and I think that says everything about the absence of stability at the top of the shop. So I think, and Matthew, I know, will tell you a little bit about his plans for using his appointment as a substantive chief executive to create the executive team for the future. And there are already 3 permanent executive director posts out for recruitment with a view to those people being in post over the course of the autumn. I wanted to say something about the deepened partnership. So yes, we have always worked with our colleagues across North East London, but I think the trust has had a bit of a siege mentality historically, not surprisingly on the basis of the brickbats that have been thrown at it over the years. Part of our renewed strategy, a key part of our renewed strategy, is a sense of place. It's about working with each of our 3 boroughs, making sure that we reflect the services that are needed by their populations. They're very different populations, and making sure that we can calibrate the way in which we deliver our work to meet those needs. So I'm really pleased that we heard from Hannah about the work we've been doing with the boroughs. We'll hear more about the work that we will be doing in terms of creating integrated management teams with ourselves and other providers in each of the 3 boroughs, using for Redbridge, King George, for Havering, Queens as key anchors within those boroughs, but also looking progressively at what we can do within Barking and Dagenham, the fastest growing borough in the country. And I'm really pleased that there are well advanced plans for expansion at Barking Hospital. That I think is really important, and that provides a good focus for the trust's work across all 3 of our boroughs. We'll also be working much more closely with Barts Health. We learned during COVID the importance of the mutual aid that could be provided in terms of the response to COVID. With all of the trusts in North East London, all of the hospital sites, ensuring that as far as they could, nobody fell down, and that everybody got the care that they needed. That was good learning for the future collaboration. The biggest challenge that we will face over coming years is tackling the waiting list issue. The collaboration with Barts Health will be a significant contributor to delivering that. And the final area I wanted to touch upon was the issue of health inequalities. I touched upon this in the beginning when I talked about how hard our boroughs have been hit by COVID, and that wasn't a surprise because of health inequalities. We have a major opportunity now to reset the system, to make sure that all of our resources are focused upon those communities most in need. And I think that we have the beginnings of a strategy to work towards that. So I'm absolutely delighted that we have a new permanent chief executive. As of tomorrow, you will have a new chair in Jackie Smith, who is hugely experienced as a chair of multiple trusts, but most recently both University Hospitals Birmingham and Heart of England Foundation Trust, which is comparable to the relationship that we will hope to achieve between Barts and ourselves. So it's a great pleasure to have been working with you, and I am absolutely delighted to hand across to Matthew to say a little bit about the future that we face together.
Thanks very much, Mike. Next slide, please. So I just wanted to start by saying thank you to Mike and Tony Chambers, who was my predecessor in this role. He was the chief exec through the sort of thickest days of the pandemic, and I want to say thank you to Tony and the exec team for all their hard work during this, and to recognise the huge effort that they and our leadership teams and clinical teams and our support teams across the trust have put to get these to where we are today. It's interesting, Mike, you said about 15 chief execs here in 20 years. In my previous trust, I was the 3rd chief exec in 20 years. And that gives you an idea of the extent to which actually BHRUT has had to cope with that degree of instability and change at the top. And that affects your ability as a trust to plan and form relationships. And actually coming into the trust, one of the things I've been really struck by is how keen people are to start to think about the future in terms of longer term developments within the trust. And that's in the context of an environment where our communities have been hit tremendously hard. Many lives in this part of North East London have been saved as a result of what people within this trust have done. But we've also seen lives lost, and people have waited often too long to get the care they need and continue to wait too long to get the care they need. Our staff in addressing this have put themselves through a lot to maintain care through the pandemic. And I think it's worth reflecting on the quiet courage many of them have shown and continue to show in coming into work every day. I spoke to our lead chaplain this week, and he reflected to me the sense that people sometimes feel a little frayed around the edges. At the minute, you know, they faced a lot in their personal lives, they faced a lot in their professional lives, and there is, I think, still a sense of anxiety and fear about what this winter will bring. And it's noticeable that you come into the hospital and we have infection prevention and control measures everywhere. And yet when you go out and you go into local shops or you go into a supermarket, it doesn't feel like the same world. And yet still within the hospital, COVID is very much with us. And COVID and its impacts are very much with us and will remain so this winter. So the pandemic's left us with challenges in this year ahead. We need to reduce our waiting lists for planned care and cancer, to make sure that people who are ill and who need an intervention, whether it's surgical or diagnostic, etc., get access to that care at the time when they need it. We need to cut the waiting times people face for emergency care and to work with our partners there to manage demand, to make sure that people who are arriving at the hospital who perhaps could have accessed services elsewhere have had that opportunity, but also that when they get here, they don't wait too long to get the clinical interventions and support they need. And really importantly, we need to look after our staff. The workforce is everything in the hospital. It's everything in terms of the ability of us to deliver good quality care, maintain that reliable, safe care through this coming winter and the times ahead. And you've heard from Ben and Remy and others about the work we're putting in to make sure that we look after those people, our most valuable asset, as we work through this winter and then start to plan for what the next couple of years will bring. And I've mentioned here culture. Culture is the way we do things around here, and us defining our culture clearly as a trust is fundamental to our recovery and to our eventual success. When you have a good culture in an organisation, it means a better experience of work for our staff, and when staff are happier and more content in their work, that leads to better care for our patients. You can see from our staff survey that still too many of our staff do not have the right kind of experience at work. And this is a really important part of what we do as we build this into a successful trust for the future. We need to be clear that this is a trust where I want people to feel as though they're treated fairly and treated with respect, and that we send out a clear message that behaviour that's experienced as bullying or discrimination isn't acceptable. And we need to think in this context about how we reduce stress in the working environment too, that often makes what should be routine day-to-day interactions between different teams a source of frustration and difficulty because people are pressured and under pressure and respond to people in that light. And we need to look very carefully, as Remy's talked about today, about our recruitment processes to make sure that we're a trust that recruits and supports people to develop fairly, and that we increase the diversity of our leadership teams so that the people who are in senior roles within the organisation look more like the populations that we care for, because that supports aspiration within our workforce and creates a stronger bond with our communities. And we've seen some real successes, for example, in the vaccination programme, having more vaccinators drawn from local communities. It builds stronger trust with people who use our services. So what we've got to look at is getting through this winter, cutting those waiting lists, cutting waits for emergency care, really investing in our staff and people, and then building a stronger culture and a strategy for the trust that takes us into the future. So we've got some elements of the services we provide that really are among the very best in London, and actually in some cases I'd imagine in the best in the country. You look at the progress we're making across surgery, across diagnostics, and some of the areas of care where we're investing in state-of-the-art technology and developing some fantastic innovative multidisciplinary pieces of working. We're cutting our 52-week waiters at a rate far above many of our compatriots in London. And we're often to be seen in the top couple of trusts in London in terms of the work we're doing to reduce some of the high volume, low complexity waiting lists that have built up during COVID. You can see on this page some of the examples of the things we've done, the Da Vinci robot we've introduced, the extra ultrasound equipment we've got in place, And I had the real pleasure yesterday of talking to our endoscopy teams who unfortunately didn't win a BMJ award last night, but who frankly deserve to for the fantastic work they've done as multidisciplinary teams to cut our waiting lists and get to the stage where we're now taking patients from across North East London to help the ICS as a whole reduce people who are waiting for that kind of surgery. There really has been some fantastic work going on at this trust, and while there's often a big focus on some of our more challenged areas of delivery, it's worth reflecting that we have many services here where you could say that they are very much places you'd want your family to be cared for. You know they would get cared for on time and receive a really excellent service. And it's important that we take the time to reflect on the many people who get the care they need from us and the pride that those staff should take in the care that they deliver. There is lots in this trust that really is among the best in class. And it was great to have Sir David Sloman here the other week reflecting on how many lessons there are to be learned from the work we're doing here right across London. And I think it's really important that as we think about the years ahead, that what we're doing in terms of building the Trust's overall strategy is building on some really important points of strength. And if you look at this next slide, here's a couple of examples of some of the work that we've seen across the Trust to really get into some of these waiting lists for trauma and orthopaedics, urology, children's eye surgery, neurosurgery, the work the endoscopy team we're talking about later. There is much to be very, very proud of here. One of the best things about these areas where we're succeeding is the sense to which the whole trust pulling together to get behind it. It's the medical leadership, the surgical leadership, the nursing teams, the business support teams, the admin teams, estates. Where we are thriving, it's because teams are pulling together across all disciplines, treating each other with respect, looking at each other's perspectives and using those perspectives together to really build some first-class services. And I'm very proud to be part of a trust that can deliver this kind of care for North East London. And yet there are other elements of our care where we are compromised and we're struggling. And we'll talk a bit more on this next slide now about improving emergency care. The emergency departments at both of our trusts are very busy. And what we're seeing is huge demand right across the NHS. Our colleagues in general practice are seeing huge demand for appointments, community care, mental health care, hospital care. We're all under lots of pressure. And what we want to try to do is to cut waiting lists across these services by first making sure people get to the most appropriate care. But then when they do have to come into the hospital for emergency care, to make sure that we care for people safely and in the best environment we can offer. With the best will in the world, people are going to face long waits at both of our sites this winter at times. There is a very high level of demand out there, and COVID makes it more complicated to provide care for people in safe environments. So we need to make sure we're really focused on safety there, and also that we're focusing on the experiences of our staff who are coming into work some days in very busy, very complicated environments with lots of dynamic assessment of risk as part of their day-to-day job to make sure people are cared for safely. And we need to work in partnership with GPs, London Ambulance and our community partners to get this right. And what you can see there is some charts that show our performance around the 4-hour access standards at both of our sites. And really we need to make sure that we're improving this time that people are waiting to be cared for, but also that we're very focused on safety and patient experience in that. Because with that safety and patient experience, it also creates a better environment for our staff to do what they're good at. And it's important to say that performance in ED only ever reflects the way the whole hospital and the system works together. And when you see these 4-hour waits and these 12-hour waits in emergency departments, that says something about the whole system across BHR is working. We've got some really exciting estate developments going on across our sites to try to help create better environments for this. And there's a brand new A&E department at King George Hospital that will be open at the end of November, and I think will be one of the best in the region in terms of its design, how open it is, how good the sight lines are for the clinical staff, the observation areas, the staff areas. That's a really important part of our investment in King George, which as a hospital has a very bright future. Here at Queen's, we've got a new children and young people's assessment unit. We're doing additional work around the ED to create space for same-day emergency care to reduce unnecessary admissions. And there'll be a lot more for us to do here at Queen's to get that emergency department into the right place. We've got some really great frailty units at both hospitals. It was notable that London Ambulance last week talked about our frailty unit as an example of best practice in London at their own AGM, where frail and elderly patients arriving at either of our sites can be taken through straight to a specialist unit to avoid them waiting in ED. We're having a great success rate about getting those patients home without admitting them to the hospitals. So that's another example of where some of the care at Queen's and King George really is amongst the best in the region. But we do have this overall challenge where, because of delays right through the hospital pathway and the way we're trying to work across the patch, too many people are waiting too long in our emergency departments. This has been a long-standing problem here, but it's very much something that local residents notice about the trust. And actually, until we can start doing more to turn this around, I think too many of the good work that the trust does is overshadowed by this. But to be very clear, this isn't just about the ED, this is about the way the whole hospital works. It'll take a whole hospital approach to put this right. This is very much going to be one of my priorities over the year. So I've talked a lot, unapologetically so, about looking after our staff, and some of the programmes of work we'll have this winter will be looking after their physical and mental well-being, after their environment, and giving them the right tools and resources for the job, and also supporting them with their learning and development. So people don't mind working hard, and this is always going to be a trust where when you come to work, you know, there will be hard work to be done. But when you give people a good environment and a supportive, respectful team, people don't mind that hard work. So it's really important that we're looking after our staff, giving them decent places to have breaks, making sure they've got access to cold, fresh water, that they've got lockers to put their equipment in, that we can help them with their journeys into work and try to take as much stress out of their day as possible so they can do the tool they're trained to do as well as possible. And learning and development gives people that hope about their career and that sense of their development as a person over the future. So we really need to make sure that we're focusing on this. We need to treat each other with respect and recruit and promote in a fair and transparent way that recognises people's abilities to contribute to diversity and difference within the trust and gives them a chance to use their skills upright. We're bringing in a range of wellbeing initiatives based on listening to staff, working with our partners in our trade unions and in our staff networks, improving the quality of food and drink, better staff rooms, psychological support for people who are going through some really hard times, and things like the Thank You Week to really call out what they've done. We will continue to work with our staff to get this right. This is not just a short-term winter COVID initiative. This is a really critical plank of the Trust's recovery and making sure that we have good quality hospitals both at King George and Queen's that are fit for the future. And last, I want to talk a bit about partnership working, which we've heard a lot about today. But you know, if a hospital is having a tough time, or if a trust's having a tough time, sometimes there's a bit of a tendency to circle the wagons. But actually, that is never the answer to success in the context of an NHS trust, because our trust is a critical part of our local communities, and the future success of this trust rests in its communities. They're both the communities of NHS providers across North East London, working with BART through the collaboration we have with them, also working with the Homerton as part of a broader provider collaborative, and importantly also with our colleagues in Essex, many patients and many of our staff move backwards and forwards across those borders. We need to do far more to work with primary care as well, so there's less of a sense that primary care and secondary care exist on different sides of a wall, and that sometimes it's difficult to get patients what they need when patients move back and forward to there. And I'm really looking forward to doing more work with our primary care partners in North East London to bring those partnerships to life. Our community and mental health partners in NELS, really important because so many of our patients have long-term conditions that rely on the care that NELS provide and primary care provides to stay well for as long as possible and to avoid those hospital admissions where we possibly can. And so when we talk about partnership working in the NHS, it works in those multiple dimensions. There's also vitally our local authority partners in Barking and Dagenham, in Redbridge, Havering, and recognising actually that much as the NHS is under pressure, their services and their finances have been under tremendous pressure for many years now. And actually our success is closely intertwined with them, with their ability to provide good quality public health interventions to keep people well and improve their fitness, and also their ability to care for people in social care and keep them in a good place where they can live independently for as long as possible, or when they're ready to go home from hospital, to go home to a good, safe, appropriate environment. So very much the success of Queen's and King George, it's integral to those partnerships and that piece of partnership working. We've also talked today about people like Sarah Towell, that patient voice, that partnership voice, the voice of our voluntary sectors. And I hope that in the years ahead, and certainly over this winter, we continue to capitalise on those relationships we built during COVID, to build this trust into a place that's at the heart of a really strong network of partnerships, because that is where ultimately the success of the HRUT lies. It lies in a network of stronger embedded partnerships. It relies on an organisation with a good culture that doesn't tolerate inappropriate behaviours and that celebrates the diversity of its staff in a way that reflects our local population. And I'm sitting here, as Mike said, as the 15th Chief Exec in 20 years. I'm here because I'm optimistic about the future of this trust. I'm not naively optimistic because I recognise the amount of work there is ahead of us to get to the right place. I'm optimistic because I've spoken to many, many people who work here and many, many people who are cared here at both of our sites. since I joined. And there is a huge amount of quiet pride and optimism in the place. There's confidence in people's careers. There's confidence in the levels of skill and technical ability and excellence that we have within the organisation, that we can build on that. And actually, there's a real sense of wanting to pull together as a family across our sites to build this into a stronger trust for the future. There will be hard times ahead this winter, and there'll be hard times in the years ahead as we come rightly under pressure to actually do a better job in terms of balancing our books and improving our performance and improving our quality in areas where it isn't good enough now, but where it can get better, and where by working in partnership and setting new standards for the future, I'm confident we can get into a position where if we can all look around and say actually that this isn't just a trust that has elements of great care, elements of good care we can be really proud of, but where across the board this can be a trust we can be very proud of. To say hand on heart, there's nothing we do here that we wouldn't be proud to recommend to our loved ones. I'm optimistic about the future, very grateful to Mike for encouraging me to explore the opportunity here, and I want to say thank you to him, and also thank you to my executive team colleagues and leadership colleagues across the trust, because with the team that we're building here, I think we have every reason to look forward and say that BHRUT has a strong and bright future as an important part of the NHS in North East London. Thank you.
Thank you. So we'll open up to any questions. So Andy, is that a question from you?
Yes. I've got three questions, Chair.
We'll take all three of them then, and then I'll pass across to Matthew, who will field his team as appropriate. So Andy, your three questions.
Well, I'll amend the first one because you allow me to speak, so I'll drop that. The first one was about banning the public from speaking. The last one, that it's a gesture of goodwill. Hopefully you guys let the public speak at future meetings. So it's now two questions. Do you agree that the appointment of Jackie Smith as your chair tomorrow undermines public confidence in North East London NHS governance due to her involvement in the NHS expenses scandal? And thirdly, firstly, it's very welcome that you're saying that there is a bed shortfall. To my mind, it follows on from the need for a new wing at King George for the surplus for the bed shortfall. So do any of your staff support the campaign for a new wing at King George Hospital? Thank you.
So Andy, I will. It's not appropriate for Matthew to say anything about the appointment of Jackie Smith. So I will say Jackie is an experienced NHS chair. She has passed the fit and proper person test. Therefore, she has been fully approved to be the chair of our trust and BART. And I think that she will be a fabulous chair of both organisations, bringing the leadership qualities that we need. Matthew, in relation to the beds issue, so we have commitment, we have a plan for moving forward on the increasing the number of beds. Do you want to say a little bit about where we're at with that plan?
Certainly. So we have plans in place across both of our sites that we're looking at the minute in terms of the expected demand over the winter to make sure that we have as much staff capacity as possible to care for demand on both of our hospitals in all the relevant pathways. There's an issue in terms of staffing availability, so there's no point us opening up multiple new wards if we don't have the workforce in place to staff them. So what we're trying to do at the minute is look at the balance between demand, the potential to improve length of stay and reduce length of stay to make more assets, more of the assets we've already got, but also to recognise where we do need to open additional beds. And there are plans in place across both sites as the critical care developments on both sites complete their build, which they will do over the course of the new year, to open more capacity, both here at Queen's, where we'll be opening an additional 30 beds, in Sky A ward early in the new year to try to help us with our acute and emergency close, and also looking at King George Hospital, where there'll be a number of wards gradually coming back on stream over the next few months. And that's going to allow us to expand our bed capacity there to provide more support for urgent and emergency care, in addition to the considerable surgical capacity we've got there. In terms of the demand for a new wing at King George, we certainly have plans in mind to expand our elective capacity at King George Hospital, and we're looking at providing additional theatres there potentially over the next few years to increase surgical output. In terms of more medical beds, I'm not clear that there's a strong argument for that there yet, partly because there isn't a workforce to staff them with, And what we need to do is really try to maximise initiatives like our frailty assessment unit, which has significantly reduced the number of people that need to come into hospital, and to work with partners like NELF and others to see where we can care for more people more effectively in the community. Something that's been really brought home during COVID is that acute hospitals are not great places to be if you're elderly and unwell. Despite first-class infection prevention and control measures, they're still not a great place to be. People who are in the frail stage of life rapidly lose lung function and muscle tone when they're in hospital beds. And actually, the more they can support it to be at home in their own environment, it's better for their physical and mental health. So I'm not wedded to the solution of increasingly growing the size of acute hospitals as a long-term solution to the NHS's pressure and challenges. I think it's important that in addition to the beds we are going to open here over this winter, that we do also look at how we can provide more services in the community to keep people well for the longer term. But please rest assured that as these plans develop, we'll be very clear about our rationale and the basis for these decisions through discussions at board level. And I'm very happy to commit to transparency, as we have done with our local health and wellbeing boards, about the numbers of bed, the nature of services on both sides, and we'll be regularly reporting on that and open to challenge and question on that in public fora.
Thank you very much for the detailed answer.
Thank you. Are there any other questions? I can't see any hands up. I think
Any questions for me?
I think on that basis, I'll say thank you, wish all of you the very, very best for the future. And thank you all for joining us at today's AGM, which I hope you enjoyed. You've got a good sense of reflection.
You're not going to get away, Mike, as well, without us just saying thank you. Because Mike has been, thank you, the chair here for the last year during, I think, what we've heard today has been, a once in a century pandemic, one of the most challenging times the NHS has ever faced and hopefully ever will face in our lifetimes. And in addition to this trust, you've also been looking after Croydon, which is not without its own challenges in terms of, one incredibly busy hospital there with lots of the same issues that we face. And you've been riding several horses simultaneously while offering leadership and support to people here. And I'm grateful on a personal level because in the conversations with you, it was your optimism about the real potential within this trust and the sort of strength that lie within this trust that encouraged me to apply for the job. And as I see you as a man with vision and a man with integrity, that was one of the things that attracted me here in the first place. So I'll always be grateful to you for that, Mike. I may have moments of doubt in the middle of January and February, I suspect, but I'm very grateful to that. And you've set a fantastic tone for the place through what's been a very difficult period along the two chambers. So I wanted to say thank you to you. It's a small gift which I'll leave in the no man's land in the middle of the table, but this is on behalf of the exec team and others here. I wish you all the very best in whatever your career has to throw at you in the years to come. And I'm sure there'll be plenty more.
Thank you. Thank you all very, very much. And on that note, we close the AGM. Thank you all very, very much, and wishing you all the very, very best for the future. As Matthew says, there is a bright future for the organisation, not without challenge, not without hard work, but actually everything that you need, foundations for it, are all here in already. Good luck.
Thank you.
Thank you.
Yep. Thank you, Mike. Thanks very much. All the best. Thank you.